Hello, I'm Brian Powell. I'm the Medical Director of Electrophysiology at Sanger Heart and Vascular Institute, which is part of Atrium Health. We have a team of 10 physicians that specialize in heart rhythm disorders, and we work closely together with 9 physician assistants and nurse practitioners. We have a really strong focus on atrial fibrillation. That's one of the key areas we focus on in addition to treating other heart rhythm problems. We have all the advanced technology, the latest equipment. We participate in a lot of national and international research trials to provide the best cutting-edge care for you. We look forward to working with you, and I am here today with my colleague Garrett Bostwick.
Like Dr. Powell said, my name is Garrett Bostwick. I'm one of the physician assistants with Atrium, Sanger Heart and Vascular at our Concord location, Atrium Cabarrus. Like Dr. Powell said, we offer the same heart rhythm services up at that location as well. Excited to meet you and have you. But today, Dr. Powell and I are going to talk to you about the triggers for atrial fibrillation.
So I'll discuss 4 common questions that come up about potential triggers of atrial fibrillation. First one is caffeine. A lot of patients ask me, is caffeine causing my atrial fibrillation? Well, it can be if you're drinking higher amounts of caffeine. We generally recommend 1 caffeinated drink per day is fine for most people. Some people get by fine with 2. But if you're drinking higher amounts of caffeine, whether it's coffee or sodas or energy drinks, that can potentially trigger episodes of atrial fibrillation. So caffeine in moderation is really one of the key takeaways that we recommend. Second topic is alcohol. There are several studies showing that alcohol can be a trigger for atrial fibrillation. Now the good news is we're not asking you to eliminate it completely, but again, moderation is the key. Binge drinking is one potential cause of atrial fibrillation. There's something called holiday heart, where someone goes and has an event with friends or family and drinks higher amounts of alcohol, and that can sometimes trigger atrial fibrillation. The other thing is some recent studies have shown that daily use of alcohol can be a risk factor for developing atrial fibrillation. So we recommend not drinking alcohol every day, but again in moderation. So again, with alcohol, avoiding binge drinking and also not drinking alcohol every day. Not that you need to eliminate it completely, but just in moderation. Third topic is how weight relates to developing atrial fibrillation. We've always known that weight is a risk factor for atrial fibrillation. There have been a few studies recently that have really enlightened how much of a risk factor it is. A couple studies showed that for individuals who are overweight, those who successfully lost weight were able to completely eliminate their atrial fibrillation for about 40% of people. So again, about 4 out of 10 people, by losing weight, completely got rid of their atrial fibrillation. So if you are overweight or above your goal, then that's an area where you could potentially work toward some improvement. And to achieve that, it's often a combination of both healthy diet and exercise. You can eat as many fruits and vegetables as you want, and that helps you stay full, but we do recommend cutting back on other things on your plate to keep kind of lower calories, good portion sizes of food, and that can help you get to your goals. Fourth, and this kind of ties in with exercise. Exercise is the other key component to helping lose weight. So for most of us, exercise is beneficial to help lower the chance of developing atrial fibrillation. There's a very small percentage of people where there's an exception, where they're marathon runners or extreme athletes or do really intense exercise. That can sometimes be a trigger of atrial fibrillation. But again, that's a very small percentage of people. For most of us, exercise is a good thing and recommended to help lower your risk of developing atrial fibrillation in the future. So to summarize those 4 things, caffeine in moderation, 1 caffeinated drink per day is fine for most people. Alcohol in moderation, avoiding binge drinking, and also not drinking alcohol on a daily basis. Getting down to a healthy weight, and then also for most people, some degree of exercise is good. For those extreme athletes, cutting back a bit from the extreme athletics could help lower your chance of future atrial fibrillation episodes.
So to kind of piggyback with what Dr. Powell had been going through, a 5th trigger for atrial fibrillation can be fatigue or physical stress. When you're either physically exhausted or sleep deprived, that can oftentimes make you a little bit more likely to develop atrial fibrillation. So it's important to take care of yourself, get enough sleep, have good sleep hygiene, eat healthy, exercise, and also just to take care of your emotional well-being as well. Number 6, emotions can play a role as a trigger for atrial fibrillation. When you're upset or happy, Emotional extremes can sometimes lead to recurrent atrial fibrillation. When you're anxious, sometimes you can feel your heart flutter, skip a beat. That may not necessarily represent atrial fibrillation, but I think it's important to take care of your emotional well-being as well to make sure that that doesn't act as a trigger for your atrial fibrillation in the future. 7, dehydration can play a role as a trigger for atrial fibrillation. It's important to drink lots of fluids throughout the day to make sure that you're hydrated. Being dehydrated can cause electrolyte shifts in your heart that can sometimes make it more likely for you to develop recurrent atrial fibrillation. So staying hydrated, especially when active or participate in exercise, can be important. Medications such as over-the-counter medications or supplements can also sometimes lead to recurrent atrial fibrillation. It's important to talk to your doctor if you plan on trying over-the-counter medications or certain supplements, as they might be able to advise you which ones may be contributing to possible recurrent atrial fibrillation. Similarly, illicit substances such as cocaine or other stimulants can cause stress on your heart, which may also make it more likely for you to develop recurrent atrial fibrillation. Finally, surgery or other medical procedures can make it more likely for you to develop atrial fibrillation. Now, oftentimes these are unavoidable. Surgeries can be urgent or emergent, and oftentimes other procedures are necessary to improve quality of life. It's important to let your doctor or surgeon know that you have a history of atrial fibrillation so that they can be prepared to management if it does occur.
So today we talked about several different triggers for atrial fibrillation. We talked about, not that you need to completely give up anything, but caffeine and alcohol in moderation is really kind of the key message. We want you to have a healthy, enjoyable life. And as far as other key triggers for atrial fibrillation, maintaining a healthy weight is a good goal to have. Exercise is good for the vast majority of people. Garrett talked about some other key things. Make sure you get enough sleep, stay well hydrated. When you add new medications, just check with your doctor to see make sure it's not a stimulant that could potentially trigger atrial fibrillation. There'll be just a small number of medications that have that effect, but you can check with your doctor whenever you start a new medication. We hope this helps you so that we can work together with you to help prevent future episodes of atrial fibrillation. Certainly teamwork with you working on all these trigger side of things while we work with adjusting your medications or offering you an ablation procedure if that's the right thing for you. So please feel free to ask us any questions. We look forward to working with you in the future.
Yeah, like Dr. Powell said, we appreciate your time. Thank you for watching, and we look forward to meeting you.